Today I'm going to give you scapula anatomy. So right now I have it articulating with the proximal end of the humerus just to show you that the humeral head articulates with the scapula at the scapular-humeral joint, glenohumeral joint, glenoid fossa, or cavity. It can all be termed that. So I'm going to move the humerus out of the way so we can continue to talk about the scapula. So the scapula has three borders, three angles, and two surfaces. So we have the inferior angle, which you already know is at the level of T9, and we use that for the chest x-ray. We have the superior angle, which is on the medial side or vertebral side of the scapula. And we have the lateral angle, which is also where the scapula head is and the glenoid fossa or cavity. And then right behind the head is the neck. You also have the borders, so this would be the lateral border or axillary border because it's closest to the humerus. You have the vertebral or medial border because it's closest to the spine, and then you have your superior border right up here. Now you have your superior angle, your superior border, and then this notch right here is the scapular notch. The two processes that are coming off of the scapula are the coracoid process. Do not confuse it for coronoid in the elbow. The coracoid process, which pretty much extends kind of over anterior to the head of the scapula, and it doesn't articulate with any other skeletal structures in the human body. The second process that comes off is known as the acromion, and this actually articulates with the clavicle, making up the acromioclavicular or AC joint. That comes off the posterior aspect of the scapula, okay? And so now we'll get into the borders here. This is the surfaces. This is the dorsal surface, and then that crest separates the dorsal surface into a supraspinous fossa and an infraspinous fossa. So the area above the crest is the supraspinous, the area below is the infraspinous fossa. As I said, we've got the scapular head, the glenoid cavity, the glenoid fossa right there. We use the coracoid, C-O-R-A-C-O-I-D, coracoid process as one of our localizing landmarks to find the central ray for the scapula and the shoulder. So that is your basic overview of the anatomy of the scapula. And this happens to be a real human bone.